ACE inhibitor drugs. These are drugs from the vasodilation drug type. So they're used to increase the size of the blood vessels, to vasodilate them. And ACE inhibitor drugs, that means angiotensin converting enzyme inhibitated drugs. So they are inhibitating or blocking, stopping, halting that the angiotensin converting enzyme is doing its job. Normally, if the blood pressure is falling, then the kidneys are releasing renin. And that renin is then converting angiotensinogen into angiotensin I, which is the inactive form. And here that thing comes, that angiotensin converting enzyme, which is inhibited through the drugs, which is converting the angiotensin I, the inactive form, into the active form, angiotensin II, which then causes the blood vessels to constrict, which is inhibited, that it is converted in the first place into it, and the blood vessels are not constricted, and where the blood vessels stay bigger, so vasodilation drug. The blood vessels getting bigger, because the bigger there's less pressure, less blood pressure. These ACE inhibited drugs are used against heart failure, for example, or against hypertension, so high blood pressure, or diabetic neuropathy. Neuropathy is diseases of kidneys. And these angiotensin II, that would also act on the adrenal cortex, the outer part of the adrenal glands, to release aldosterone, which are increasing the blood pressure, which is also not happening because the angiotensin II is never made. And they are often given together, these ACE inhibitor drugs, with diuretic drugs, and the diuretic drugs, they are there to get excess water out of the body, and together with beta blocker drugs. The sympathetic nervous system is giving out at its nerve endings the called beta receptors, noradrenaline, and these noradrenaline are making the blood vessels to constrict, so that is also not happening. And also these noradrenaline are also released by the medulla, which is the central part of the adrenal cortex. And this is so ACE inhibitor drugs, they are inhibiting that the angiotensin converting enzyme is converting angiotensin I into the active form angiotensin II, which would cause the blood vessels to get smaller. And that is inhibited. And that is according to the Illustrated Medical Dictionary written by Stuart Davidson, Penny Preston, and Francis Williams. The main article is on page 7, but of course on several other ones as well. But this is now medical advice and also now substitute for medical knowledge.